Epilepsy is a neurological disorder that affects nearly 3 million people in the United States and 50 million worldwide. It's caused by electrical discharges in the brain, which send signals throughout the nervous system. These signals can contrast in severity and lead to a variety of seizure types. While FDA-approved medications and other treatments have been known to help, still nearly 1/3 of all people with epilepsy continue to have uncontrolled seizures, severely limiting their overall quality of life. Some, however, are finding relief through a different form of medication, one that is controversial among doctors and lawmakers alike.
When you're walking through Times Square and you have had a seizure, you think about the 15,000, 20,000 that are walking through there and just the catastrophe that would be caused. But when I used cannabis, it started blocking these thoughts out.
Tim DeJow is 24 years old from Clifton, New Jersey. He has been suffering from epilepsy since he was diagnosed at age 10.
So it sounds to me like the cannabis wasn't just seizure control, it was a release from this anxious feeling.
It was. Instead of looking at it and saying, oh, he's having seizures, let's use something to block it, let's just use something to cancel out the effects of epilepsy, it was in fact removing this anxiety.
Tim's anxiety is a result of 14 years of seizures. In an attempt to help control his epilepsy, he's been subject to numerous medications, each one with a variety of complications.
I'd say with each medication I was a different person. Each one came with different side effects. Some were easy bruising, some were hair loss, some were weight gain. And as they saw each one getting more and more severe, they had to continually transition. I'd say actually they went through probably about 4 drugs in 1 year.
Do you know other people that have epilepsy that have been through a similar pattern?
I've seen people who have had such severe seizures that they've had to wear helmets every day, that they cannot take them off. I've met other people that have about 120 seizures a day, and really you cannot talk to them.
4.
Very good. And what is this letter?
Stephen Nick is 14 years old. He was diagnosed with Lennox-Gastaut syndrome, a severe form of epilepsy, at age 2. We sat down with his mother, Georgia, in Fullerton, California, to learn about his debilitating condition.
He started having them when he was about 1 to 1.5. He started with just little jerks, and they progressed, and they went from little jerks to grand mals to absence seizures. He's got every type. We've tried everything. He's 14.
You okay? See, he's having some type of seizure. Yeah.
Some people wouldn't recognize that as a seizure, what he just did. But meanwhile, he's having them constantly during the day.
No, a lot of times, even at his school, they'll tell me, oh, he had no seizures at all today. He did so good. And I'm thinking, I know, Stephen.
It's just been a battle the whole time. And it's just relentless. It never lets up. You know, we might try something and think, all right, you know, he's seizure-free. He's been seizure-free for 2 days, and you count the days, and then all of a sudden here comes another big one, and you're back to square one. So it's
frustrating.
Yeah, it is.
A third of patients with epilepsy are categorized as refractory, meaning they continue to have seizures despite numerous medications. Here in Washington, D.C., 10,000 individuals, just a small percentage of the epilepsy population in the U.S., participate in the National Walk for Epilepsy to raise awareness and money for research in the disorder, which has been historically underfunded.
With all of our choices that we have today, unfortunately, the medications that we have haven't been proven to be more effective than those that we had several decades ago.
Dr. Evan Fertig is Director of Research for Northeast Regional Epilepsy Group and the co-director of the Epilepsy Center of Excellence in Jersey City, New Jersey.
There are still other treatments, dietary therapies, vagus nerve stimulation. Epilepsy surgery can be highly effective for many patients with epilepsy.
For Tim DeJow, surgery was an option he was willing to try. In 2006, he underwent resective brain surgery, a procedure in which surgeons remove a section of the brain in which the seizures are believed to originate.
I had surgery, and it was kind of a trade-off. I was having about 20 seizures a month initially, but they were not too severe. However, after surgery, I had fewer, but they started getting very severe, and it was very questionable how much time I could spend alone outside of school, just walking to a store even.
So the surgery actually had affected your quality of life in a negative way?
Yes, definitely so. In fact, there had to be more watching over me because my seizures were so severe. I started hitting my head very hard against the ground, leaving rug burns all the time. It became quickly evident that I needed to have a second.
Tim underwent a second brain surgery, excited this time for the change he was looking for. The outcome, however, was not what he expected.
I woke up, and just like the first one, I couldn't really move. It took me about 2 weeks to get my left arm and my left leg functioning as normal, but I couldn't move my left hand at all. And I thought, well, I officially have lost functionability there.
You must have been really scared when you woke up and...
It was frustrating for certain. I had some hope, but as weeks passed, it went down and down.
Tim did eventually regain the use of his hand. Still, his second surgery did not help the seizures. With his hopes spoiled and his fear and anxiety at an all-time high, Tim left home to attend Colorado State University. There, he soon learned of the benefits of medical marijuana.
Well, when I had initially got to Colorado, I had never thought, okay, medical marijuana, that's what I want. But I was ready to try something else. I had never done drugs, but I figured, okay, maybe it'll help. How can it hurt me at this point?
When you were younger, when you were trying all these different medications, these different prescriptions, brain surgery had been recommended, did anyone ever mention medical marijuana to you as an alternative therapy?
Not at all. I never thought about that as more than just a recreational drug. I never knew that it might have any sort of benefit.
As a Schedule I narcotic, by definition, marijuana is said to have no medical benefit whatsoever, no safe dosage, even under a doctor's supervision, and it's supposed to have a high potential for addiction.
Greg Campbell is a journalist and author of the book Pot Inc., a first-hand look at the marijuana industry, its medical benefits, and state and federal legislation.
The Controlled Substances Act divided drugs in Schedules 1 through 5. Doctors are banned by law from prescribing a Schedule I narcotic. So that's why you see in medically permissive states, the doctors recommend marijuana.
It was this type of recommendation that allowed Tim DeJow to make his first ever purchase of medical marijuana.
You, at this point, had been prescribed the medical marijuana for the first time. Tell me how you saw some improvement in your seizures.
It was just absolutely amazing. The effect just turned around my life. I realized, wow, I don't have to be bound to my apartment anymore. I can go out there, I can shake hands, I can get a job, I can live a normal, regular life. In the first semester, I got a 3.6, I was working, I was interning. I was the Tim DeJow I had always wanted to be.
With the use of medical marijuana, Tim's seizure count dropped from an average of 20 a month to less than 1. Despite his remarkable progress, some neurologists are still hesitant to prescribe the drug.
These are anecdotal reports, and what may have happened to one patient doesn't necessarily extend to another. Marijuana is not just one chemical entity, it's hundreds. I think until we have, clear federal go-ahead to prescribe it, I wouldn't.
The particular active chemicals in marijuana which are believed to be beneficial for patients are tetrahydrocannabinol, or THC, and cannabidiol, or CBD. THC has psychoactive effects and has been used to treat nausea in chemotherapy patients and reduce intraocular pressure in people suffering with glaucoma. CBD has anti-inflammatory properties and has been known to reduce chronic pain, arthritis, and seizures. By extracting these chemicals, medical marijuana dispensaries can now provide more options to their patients than the standard smoked form. Products now range from baked goods and drinks to lozenges and a droplet form known as a tincture.
A tincture is much better because you can put it under your tongue and you can go right outside. There's no sensation at all. It's almost like taking Tylenol. You really don't feel anything, but the headache goes away.
Despite these new developments and medical marijuana's current legalization in 16 states, federal law and the stigma that comes with 80 years of illegal activity, continues to create difficulty for patients like Tim DeJow.
I was on day 96 of no seizures, and my parents had said, well, let's fly out from New Jersey. We can be there on day 100. It'll be exciting.
Days before this momentous occasion, however, Tim's landlord discovered marijuana in his apartment. Concerned about legal action, he left Tim a note threatening eviction. Despite his right to possess under Colorado state law, the fear of losing his home drove Tim to quickly dispose of all traces of his medication.
2 days later, I was walking and I fell and I had the seizure, and I could just feel myself raking my face against the concrete. That seizure was so severe that I woke up with my face completely torn off. There was so much bleeding, so many cuts.
Like all anti-epileptic medications, sudden withdrawals can lead to additional seizures. Tim was rushed to the hospital and treated for his injuries.
The truth of the matter wasn't even the fact that my face was bleeding so much. It was that I just almost made it to day 100. And I never have again. Ever since, I've never been able to make it that far.
So what do you do now? How do you get the marijuana?
I don't even use it, honestly. I've just pretty much backed off of it because I feel like, you know what, it's not worth being judged. And so I have more seizures again. I've had to experiment with new medications. It's come with new side effects. And so I'm just on a lull period of it's not worth it.
This frustration Tim feels is a common thread that binds many people with epilepsy. For George and Nick, 14 years of frustration has brought her to the point of considering a medical marijuana prescription for her son, Stephen.
I had faith in all the medications and all the drugs and all the surgeries, and now I'm down to, I have not many more options left with him. So that's where I'm at now, is why not? And when I do try it on, I'm just going to watch him closely and, as with any other medication, and see how it goes. It's, like I said, I would try anything if it would help my son.
I think it's very important for patients who are considering this that they first discuss it with their neurologist. Marijuana has been available for centuries and used medically for centuries, and it probably is effective for some things, but that doesn't necessarily extend into something that a physician could prescribe without more study.
The problem here is that because of the Schedule I that's still looming over marijuana, the ability to freely study these ingredients, these cannabinoids that have all this unlocked potential, is really in the infant stage. And once you cross that line from Schedule I into Schedule II, the drug is said to have some medicinal value to it. And it allows doctors to prescribe it and pharmacies to distribute it. And it also opens the doors to more robust medical research.
It would cost tens of millions of dollars in research and testing for marijuana to meet the Food and Drug Administration's approval. And for pharmaceutical companies to invest that type of funding, a major change in federal marijuana legislation would have to occur. Without testing, however, the laws are unlikely to change. This decades-long staring contest leaves epilepsy patients hanging in limbo, just waiting for one side to blink, hoping for one more option, and praying for a day without seizures.
Honestly, I have seen no better thing than cannabis for myself. I have seen other epileptics try it, and just like any medication, they have not had success. Once I have legalization from the state, I will use it again because I have seen more beneficial effects in myself than any other medication I've taken. It hasn't just improved epilepsy, it's improved Tim DeJow. I'm someone that's never been stronger.